Hi, my name is Amy Trezek, and I'm a speech-language pathologist and owner of Achieve Speech Therapy. If you're watching this video today, you're more than likely a parent or caregiver, possibly a teacher, maybe a paraprofessional, that's interested in learning the hand cue system that I use with my clients. If that is the case, thank you so much for watching this video today and taking the time out of your schedule to learn these very important hand cues. The more that you and the people within your child's environment can utilize these hand cues on a daily basis, the better your child's speech outcome will be. Let me tell you a little bit about this hand cue system. It is not something that I've made up on my own. I'm not really sure who it was that put these hand cues together first. I received the list of these hand cues when I was a graduate student from a clinician that had been practicing for many years. She did not know the source of the cues, so I apologize to the speech-language pathologist that came up with these. I have tweaked these a little bit to make them appropriate for my kiddos. So let me tell you a little bit about them because I really love them. I think that they have worked well in my practice. I know that they certainly worked well in the practice of the speech-language pathologist who was using them for many years. They are very much similar to hand cue systems that are out on the market today that you can purchase. The reason why I like these so much is because they really do a great job of showing where the sound is made, either in the mouth or at the throat. And also, they differentiate between the cognate voice and voiceless pairs. So any sound that is voiced is going to be made with a fist as the cue, and any sound that is unvoiced, that means the vocal folds do not come together and do not vibrate, those are going to be made with fingers. Let me give you an example of a voiced and a voiceless cognate. These are pairs of sounds that are essentially exactly the same. The only difference between the two sounds is whether they're made with the vocal folds together to produce that sound vibrating, that would be a voice sound, or not together, the voiceless sound. An example of this would be a B and a P. A B and a P are both made at the lips. They're both made in the same way. The only difference is that with the B, the voice box comes on, you can feel the vibration in your throat, and with the P, the voice box does not. Those vocal folds do not come together. So as I present these hand cues, I will try to present the cognates together so you can get a really good idea of the reasoning behind the system. Let's start with the B. The B is fisted. The knuckles are actually pointed towards the communication partner. The fingers then come towards the mouth. Ba. Ba. As the sound is made, the hand goes away from the face. Now let's look at the voiceless P. That is made at the lips. We put two fingers up. Those fingers go towards the lips. And the fingers go away from the mouth as the sound is made. Let's look at the D. The D is a voiced sound just like the B. But instead of making the fist with the knuckles towards the communication partner, the D is going to be made with the fist rotated, the thumb towards the mouth, the pinky towards the communication partner. This is also made towards the mouth, duh, duh, and pushed away from the face. The T is very similar. It starts with the fist, however, the index finger comes up and the index finger goes towards the mouth. And the finger is pushed off. It's really important that the finger gets pushed off for the T. Otherwise, it looks like the hand cue for the SH sound. My hand cue for the SH sound, the finger comes up but stays. Shh. Shh. almost as if you're hushing or shushing someone. Now let's look at the V. The V is a voiced sound. We're going to do a fist much the same way as the B. That fist, though, is not going to come towards the lips. It's actually going to go towards the chin. And I keep my fist on my chin. The voiceless cognate for the V is the F. That's going to be 2 fingers. And they are going to go on the chin. And I flick those fingers off. The next sound is the G. It's voiced. So we'll start with our fist. And the G sound is made at the throat, so that's where the fist is going to go. 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 The next sound is the K. We're going to use 2 fingers, and you guessed it, we're going to put them right at our throat. K. 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 Now for the H. The H in this program is done a little bit different than what it's done in other programs, and it really doesn't matter how you produce it. It's kind of a similar effect. I put my hand up, kind of sideways here, up to my mouth, and produce that sound. And there are other programs where the hand comes up and to the front of the mouth, and you're actually blowing that air onto the hand. Either way works. Next sound is the J, as in judge. I'm going to use a fist on this one with my thumb up, and I'm going to kind of shake my hand down as I say this sound. J, J, J. Next sound is the L. And with the L, I will curl a finger kind of up and back at my face. Oh, oh, oh. The R is very similar, except it's with 2 fingers. The M, I use both hands at my cheeks. So this is a very big sound. The N, I put a finger on my nose. That's where your air is going to be coming out. The next sound is the S. And to do the S, you have to use your whole arm. So I'll put my arm out. I'll take my other hand. You can use the whole hand. You can use, a few fingers, whatever you'd like. And swipe it from, the top of your arm all the way down. You can do from the elbow down. You can do from the top of the arm down, just as long as you have one long movement down your arm. Really helps get out that long sibilant sound. Now the Z, you'll keep that nice long arm out, but you're going to fist your hand, and you're going to take your finger from your other hand, and make a zigzag pattern on your fist. Zzz, zzz, zzz. For the W sound, I'll take one finger, and I will kind of go in a circle around my big rounded W lips. Ooh, ooh, ooh. For the Y sound, I'll take my thumb and my index finger spread wide, kind of place my chin in the middle to make that sound. Yeah, yeah, yeah. And it really emphasizes how wide that mouth and that tongue has to be. Yeah, 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 when you make that sound. There are some additional sounds. We talked about the sh sound, that SH sound. Let's talk about the CH sound. I do it like a choo-choo train motion. So I get my whole arm up, big fist at the top, pull down like a choo-choo train. Ch, 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 ch. And then the TH sound, I'll use a fist with one finger pointed at my communication partner. This is really going to kind of emphasize how I bring my tongue out of my mouth. Okay? I'm also going to move my arm forward. Now I use this symbol for both the voiced and the voiceless TH. Now let's put these together. If I'm cueing a word for a child, I will often put two cues together for that beginning consonant sound and the ending consonant sound. So let's say that the child is saying the word cat. I might cue the beginning and the end of that word, cat, with that K going straight into the T. Now, if I'm just working on initial consonant deletion or final consonant deletion for some of my kiddos with phonological processing disorder, I will only emphasize that end sound or that beginning sound, depending on what process I would be working on. So if it was initial consonant deletion, we would go cat, cat. But primarily for my children with apraxia of speech, I will often cue the beginning and the ends of words. Sometimes on my multisyllabic words, I'm cueing the middle consonant sounds as well. Let's say banana, I would say banana. As far as vowel sounds go, I do use hand cues for my vowel sounds. I kind of work on vowels a little bit separately than I would on my consonants. So I'm not oftentimes cueing vowels in a conversation manner. But the vowels that I use are not part of this system. I actually just use the Easy Does It apraxia vowels for elementary school levels. So they have trading cards, I believe, and so that's what I use in my own practice. So I hope that this has been beneficial for you today and that you've learned some of the hand cues. Feel free to go back, rewind, and really go over those cues, practicing them as you speak.